Hey everyone, welcome to the Nursing Insights podcast. My name is Stephanie and I'm a registered nurse practicing in the state of New Jersey. Getting right to it, the state of healthcare right now is tough, to say the least. Let's just say that the nursing shortage does not spark joy. We can sit in that and stew in it for a while, but we can't live in it forever. Things are changing. So join me as your host as I partner with the New Jersey Collaborating Center for Nursing to hear from nurses across the state about their experiences, trials, and triumphs in the nursing profession. Welcome back, everybody. Thank you for joining us here on the Nursing Insights podcast. This is your host, Stephanie, and I have the joy and pleasure of chatting today with Dr. Pamela de Cordova. Pam, thank you so much for joining us on the podcast. We're so excited to hear about your background and your history as a nurse and where you are in your profession. Could you tell us a little bit about your nursing career?
Yeah, sure. So I actually graduated in 2000, so it's about 24 years ago, and I began working at a hospital that I actually stayed for 23 years. So just last year, I actually did not, I ended up ending my clinical practice. But anyway, so I began my career in 2000 working as a staff nurse on a very busy intermediate care floor. And when I was working on that intermediate care floor, I always loved working with whether it was student nurses, whether it was new graduate nursing, whether it was nurses who came from a different facility, and I loved to precept, and I found it was a passion. And because of that, I always had a propensity to go into education. So in order to go into education or to become a nursing professor or formal nursing professor in the state of New Jersey, you need to have your master's. So while I was simultaneously working full-time as a staff nurse, I went back and got my master's. I am not a nurse practitioner. I have a master's in health leadership, and I geared it specifically towards education. At that time, I was fortunate with the hospital to obtain some tuition reimbursement to help me offload the price or the cost of tuition for my master's. And when I completed my master's, I then took an adjunct position at a community college where I taught clinical, which I absolutely loved. And the hospital was extremely gracious to me because my manager at the time allowed me to actually teach for a community college or for a school of nursing while I still maintain my full-time status working as a staff nurse. And after doing that for a couple of years, I really decided to pursue an advanced degree because there were some issues that I would see on the bedside that I thought, could only be answered if I learned how to become a researcher. But still, I really wanted to understand, I still wanted to follow my passion of teaching. So I then pursued a PhD and did that it took me 4 years to complete my PhD. And after that, I did a postdoctoral fellowship, which was 2 years, still maintaining active clinical practice. At that point, I was only per diem because my schedule wouldn't allow it to be full time. And in 2013, I came to Rutgers. I'm in the role of an assistant professor, and I've been at Rutgers since 2013.
Wow, there's so much to dig in there. Thank you so much for sharing all that. Even at the beginning of your story, you're talking about how you knew you had this passion for being a professor, for teaching. And I was curious to hear how you knew that you wanted to go into teaching versus just staying on as a preceptor or staying to a more bedside role, but also engaging in the classroom. What drew you into that understanding that you wanted to pursue that?
I think it was really because I really enjoyed it. And I loved seeing nurses, get the aha moments. And I knew that, just being self-aware and any nurse can do this, you know what you're good at. And I knew the managerial role really wasn't for me, but I knew that I had the patience and such. And I just found it fascinating. And even teaching at the community college, teaching at Rutgers, it's just so rewarding to, instill the knowledge that I know onto the future generation of nurses. And I think another thing that really is wonderful about teaching that I would encourage, nurses who are considering pursuing an academic career is that you really learn how much you as a professor don't know. And you get that because you have nursing students that will challenge you and ask you questions. And it's okay, even as the faculty member, to say, I don't know, but let's figure that out together. And it's a wonderful profession, a wonderful aspect of nursing. That's great. So I just had a passion for teaching.
That's beautiful. And you talk also about how you engaged in research as well. So you do your academic faculty practice, and then you also do research practice. Could you tell us a little bit about what it means to be a clinical faculty member versus a research faculty member?
So I would say to anyone who's actually considering a career becoming in the academic world is really to think of the type of school that you envision yourself in. If you have a real passion for teaching and research may not appeal to you as much, then you may want to choose a school that is really focused on, instilling the next generation of nurses and really really focusing on teaching curriculum design, simulation, anything that, could go to the educational modalities. If your passion is really to, drive nursing science forward and do research, then you may be wanting to looking for another school, a type of school that does have a real, we call it R1 institution that really has a focus on conducting research. Whatever school you do decide to choose, there is always the expectation that you have to have some element of scholarship. So whether you decide as a faculty member to go on the clinical side or on the research side in one specific institution, there will always be an expectation that, you are going to be doing some sort of scholarship, whether that's designing clinical practical guidelines or revising clinical guidelines, whether it's presenting at conferences, whether it is, and this is beyond teaching, whether it's publishing papers, there's always the expectation. Clinical faculty tend to really be the experts, clinicians. Research faculty are often responsible for writing grants and bringing in research dollars and conducting research. So there is a little difference about being a clinical faculty as compared to a research faculty, but there's always the expectation that you conduct scholarship. And I would then advise any nurse who's pursuing a career in academia to, again, look at the mission, look at the vision of the university or the college that you would become a potential faculty member at, and make sure that it aligns with what you actually find, passionate about being a professor or, an instructor.
That makes a lot of sense. Would you mind sharing with us a little bit about how your personal adjustment was from going from a clinical nurse, staff nurse, to becoming an academic nurse?
Yeah, so it's really interesting. That's a great question, Stephanie. As a nurse, you begin to know, after several years of practice on the floor, who's the person to go to insert an IV, who's the best person at inserting a catheter, who's the best person at responding in a code, all these clinical expertise. And you get to know that, the people you work with, the staff, the nurses you work with, and who is the best clinical expertise. When I transitioned to faculty, there were a lot of skills that I didn't have, such as designing a syllabus, how to respond to students at all different times of the day, and also set boundaries for yourself or for myself. So I'm not worried that I get an email from a student at 1:00 in the morning and I'm sleeping at that time. Also designing exam questions. There's a science to that. Students may not realize that, taking 50 question exam that's multiple choice might be very easy for a faculty member to design, but there's psychometrics behind developing a really good, solid multiple choice question. And that takes hours and multiple revisions. So skills like that, there was for me definitely a learning curve. I also had to learn that, as much as I love teaching and loving to instill the next generation, you have to have some boundaries with the students too. Navigating that world, there is a lot of work that requires when you transition from the clinical practice to the academic world. The good news about academia, though, is that when you design your course, or, if you're designing clinical students to the clinical setting, you get to know people, you get to know, which nurses you would love to take students while you're the clinical instructor. You also get to know if you're doing didactic, which is the typical or the traditional lecture, you can revamp your PowerPoint slides for another semester and you build on that and you revise it. So it's really, again, my transition from going from a staff nurse to a faculty member was really learning about how to do all those curriculum responsibilities that you really don't learn in the clinical setting. That was challenging for me.
Would you have any advice for a nurse who's maybe starting out their journey in trying to delve into academia?
Yeah, so there's two things that I have to point out. Again, you have to think of the type of college or the type of university that you are going to be interested in. And really, really, when you interview and you seek out these opportunities, just ask the person who's interviewing you, what is the expectation for scholarship? What is the expectation for teaching? Get all that information, because different schools have different expectations, and it's not nothing's bad against one or the other. It's just you need to know that right up front. My expectation is that I have to have, like I said, like I'm on the research track. So it's very important for me to continually write grants, conduct research, write papers, and that's the track that I am on, and not all schools will have that. For new people, really take advantage of mentorship opportunities from people who have done it before. We've all been there. It's just like anyone would give advice to a new nurse who's stepping out on the floor or in the community for the first time after they get their NCLEX. There's always a sense of anxiety as well. But there are people that you will find in the school that you're working with that will help you, have been there before. Maybe you don't have to when the course that you're assigned to. It's not necessarily a new course. Maybe a faculty member taught the course before and is willing to help you, guide you as you design your course objective or your PowerPoint slides or your presentations. Maybe they can actually even help you by giving you templates that you can use to craft your course. And don't be afraid to ask. People want to help you, but they might not know that you're struggling. So I would definitely say, please take advantage of the mentorship opportunities that your school offers.
I was curious too about one of the kind of hot topics that come up a lot, especially for nurses walking out of their exam and starting on the floor, but I'm sure it also shows up in academia, is imposter syndrome and this feeling of, kind of being in a place that maybe I'm not ready. Do you have any thoughts about imposter syndrome, whether in academia, research, or nursing on the floor?
So I'll be very candid about that. I've had that many, many times, a lot. Actually, especially during my doctoral education, imposter syndrome. I think actually, if you are thinking about, or if you have a PhD, I would almost guarantee that you've had some sort of experience of imposter syndrome. Again, it's okay. It is a syndrome. It doesn't mean that you wouldn't have been hired in a faculty role if someone didn't see something in you. So don't doubt you. Just as when you get your new job as a nurse, the manager who hired you saw something in you, and that's why you were hired. So try to put that negative thoughts in the back of your head, even though you might be feeling it. We are our own worst critics. I would just say, again, be transparent about what you know and what you don't know, and then seek out help when you need it. We've all started with getting our one course assigned and be like, oh gosh, I have to design a syllabus. I don't even know what a syllabus is, or something like that. So I just think that imposter syndrome is a normal feeling, but you don't engage those feelings. You were hired for a reason, and seek out someone who can actually help you and guide you. And sometimes it's little simple things that give us more anxiety, like, where do we park? Where's my office? Do I have a key to my office? What are the little things that are almost in the culture of the school? You don't want to discount them. They can be really stressors. Or if you're going to clinical, you don't want to be late. Seek out where you're supposed to park as a clinical instructor. It's at the same places where the employees park. Always try to be as prepared, like one step ahead of your first few days. But there is a learning curve. And for the imposter syndrome, I would say try not to engage those feelings. You were hired for a reason.
Yes. And I think that's something that all nurses have to remember. When you get through nursing school, you worked for it. So all of our new nurses listening out there, you worked for it, and you go out there and do your best and practice and learn, because that's part of it, is just the continual opportunity to learn. We're not expected to know everything right off the bat, and never really, because here you are with your PhD still talking about how you're also learning and constantly engaging. Kind of pivoting a little bit, we want to hear a little bit about any experiences or stories. Could you tell us about a rewarding experience that you've had working as a nursing professor?
Sure. So there's a lot. There's also some challenging ones, but I definitely always want to remember the positive ones. And I think the ones that really come to my mind are a couple of students. I have three, actually. One actually reached out to me a couple of days ago, which ironically, by this podcast, there were three students that worked with me on research projects at the undergraduate level, because we had such a great working relationship together. Both of them went to top tier graduate schools to pursue their advanced degrees. And right now they're both one is in a different type of world, but the other one is on the academic job market and is looking for a faculty position. And I know I don't want to assume credit for instilling that in this particular, or these two particular students, but I do know that having students that were students of mine and pursuing paths into academia, and also having clinical experiences as well, they got clinical experience along the way, is just really rewarding. And I think it's so rewarding from a faculty member. And you would get this on the clinical role, even when you precept. And I would speak that clinical nurses have this experience too. When your student nurse extern, or your new graduate at the very end of their orientation comes back to you and says, "Thank you so much for being patient and understanding with me," is a really rewarding feeling. And in academia, you have that opportunity to like really, just like nursing, to touch people's lives in such a profound ways. You're not always going to get along with every student or gel with every student, just like nurses. There are times that nurses always, might not gel with other nurses who are working on the same shift as you. You do have the potential to really impact people's careers and their path that they choose. So I think that has been really rewarding. There were many times at the end of the class, a class that I would have taught, that students would come up to me and give me just a thank you letter. And I hold that. I keep them. And I think it's just very rewarding. And those are the times that gets me through days when I'm in my academic world, when I submit a grant and I get rejected, or I submit a publication that I spent a year or two working on that gets rejected, because there is a lot of rejection in the academic world, not from faculty per se, but just in scholarship in general. And just going back to the fact of really students were appreciative of the work and the time that you give them is really rewarding.
That sounds beautiful. And that's something that only comes with, like you said, patience and time and effort investing into your community of nurses and new nurses. So every moment that you have of that sounds like it's well earned, hard earned. Would you mind sharing a little bit about some of the challenges that come with being either a researcher or nurse scientist or nurse professor?
Okay, so let me just start, I think, with the traditional, what most people who might be listening thinking about, like as a nursing professor without the research in the world. I think the challenging thing is, again, the time management. You're likely an expert clinician. Again, you're probably the one that people run to when you're inserting the IVs or inserting the catheter. And now you're thinking, okay, I want to take on this new aspect of my career. Just again, it's challenging to design exam questions. I should say challenging. It takes more time than you think to design an exam, to put together a lecture. I spent many times my very first year, block it out in my schedule, practicing my presentation the night before that I was going to give it to the class. And again, they probably didn't know that I did that, but I was going in to speak in front of, 60 nursing students, and I needed to be prepared. Even though I knew the content that was going to be on my slides, I needed to be rehearsed, just practicing before you actually give a lecture. I remember some good advice given to me from my mentor is that public speaking, it's a skill. We all know people that are very good public speakers who are charismatic. But if someone tells you that, they don't get nervous in front of speaking to an audience, that they're actually lying. People do feel a little bit of anxiety right when you're at the podium and other people are listening to you. And then that goes away, after, it might go away in the first 30 seconds, in a minute or two, once you get into your flow. But those first times that you're going to give your first lecture is anxiety provoking. And again, just be prepared. So that, I would say, I guess preparing for a lecture took more time than I anticipated. Preparing for a class takes more time than I anticipated. So that is something just to keep in mind out. When it comes to the type of research that I do, I had to get very comfortable with accepting rejection. And another advice that I've read, work very hard on an article and it gets rejected, is that if you took an academic CV and that academic put all the rejections on their CV and all their grants that they applied for that did not get, or all their presentations that they were going to present that did not happen or occur, their CV would be like double or even triple. So a person's CV in the academic world only shows your accomplishments or what you've actually, I don't want to say achieved, but does not include all those rejections. So with research, it is competitive, and it's competitive that there's a bucket of money and, there's very skilled researchers out there, and we're all trying to get a little piece of that in order to do our research, and we're wedded to our research, and we know that we're passionate about it and we want to solve this problem. But it's also being aware that rejection is inevitable. Like it's going to happen. I say this to now this would be geared toward people who are finishing their DNP projects or people who are finishing their dissertation, and getting their PhD. It's very possible that your first publication that you've spent years on crafting and designing does get rejected. And what you have to take from that is that that's part of the process, and you don't bury the article. It's work that needs to get out into the scientific community. You just have to recraft it. And I think, embracing, for me, that rejection is inevitable and it's going to happen is a challenge that I face a lot. So.
The way you speak about the rejection sounds a lot like the way folks look at social media. On social media, you see everybody's, vacation moments and graduation moments and all the beautiful stuff, but then you don't see all those moments in between where it's the hard work and the hustle and the grind of getting to that point of success or being able to have something to show for it. Because as you're saying, there's so much more that happens before that moment in which somebody says, yes, your abstract has been accepted, or yes, you can present at this conference. And I know we always hear the word resilience in regard to healthcare workers, but I think that there's so much resilience even in the academic front of being a nurse researcher, because there's so much out there. I had a nursing professor who told me while I was in nursing school that if you want clinical evidence-based practice, you need to be a part of the research. You need to join the research. You need to do the research, or else we won't have evidence-based practice to do. And therefore, I find it fascinating and wonderful the amount of work and the amount of effort that you put in to make sure that we have this cutting-edge research available to us to be able to base our practice off of. So thank you for all of those things you've gone through in order to help inform the rest of us who are out here learning from your great and detailed research. Do you have any insights to share about how you even come across or how you decide what your research topics would be, or how you start engaging, down that curious thought process?
Yes. And any nurse can answer this. Any nurse, I don't care what setting you're working in, if you're working in community, if you're working in the hospital, if you're working in long-term care, it's some clinical problem. It's something that's doesn't sit well with you. And so for me, when I was first, and why, again, wedded to my passion with teaching, what didn't sit well with me is, and this is now going back to about 2007, so things are different with computerized charting and such, but the amount of time, although some would argue in the clinical world that this is still an issue, what bothered me was that the amount of time that we would spend documenting and being taken away from the patient and giving direct patient care. It was always like we were getting pulled back to answer the phone. We were getting pulled back to do our documentation. And we were drilled or I was drilled in nursing school that if it wasn't documented, it wasn't done. So nurses, were really critical about saying, okay, let's make sure we do get all our documentation done. Meanwhile, the patient might be needing something. So that was my clinical problem, or something that I really wanted to solve. Now, have I solved that? To be transparent, no, I have not solved that, obviously, because I think some people who might be listening to this might be like, we still have issues where we're spending so much time at the computer, reviewing the orders, answering the phones and being taken away from the actual bedside of the patient. But I would say that if you're interested in research, anyone who's working as a nurse knows that there's a better way to solve that problem. And then that is what's going to stimulate the research. And then we do need skills on actually how to conduct a research study and how to conduct a research study methodologically that's strong, that's feasible, that's tangible, that's cost effective, all that case. But it usually stems from something that you witness that, there's better ways to do this. That's actually how it came about, that, you make sure that a patient who's vented is elevated when you give them tube feeding so they don't aspirate it. That's why, we turn and reposition patients as such. All our practice that has continually been involved is basically based on, science. There's a what stems the research is a clinical problem, something that you notice that could be done better or could be improved upon. And that's where the question comes, and your research question develops.
Let's say we have some nurses listening to this podcast who say, yes, Dr. Cordova, I have in my mind this exact clinical problem that my unit has been wrestling with, and I want to see how I can make a difference, but I have no idea how to even begin approaching. Do I get a master's? Should I go for a PhD? How do I start developing the skills needed to become a reaser? What would you tell that nurse?
Okay, so to become a researcher, then I would absolutely say go for the PhD. Okay, I'm just saying that right out. That you could quote me on that. If you're interested in research, you go for the PhD and you get the master's along the way. If your focus is that you want to be the highest clinician possible and being able to collaborate with research and, work with researchers, but maybe not design the actual study, then maybe you would go pursue a DNP, for example. But if you're really like, I have this problem, I want to study it, I want to solve it, then I would definitely recommend look for a PhD program. But that being said, you do not necessarily need a PhD to teach nursing. And I want to be very clear about that. So again, looking for what your passion is or what really drives you. If you want to become a clinical instructor and instill, work with student nurses, then you can get a master's. You can get a master's in nursing education. You can also, for nurse practitioners who already have their master's and maybe are considering a DNP. Yes, getting the DNP will get you into academia at a 4-year institution, and that's great too. And you could teach as well. So it's really what aspect of academia you're interested in. But I would definitely say for research, if you have a research problem, then I would highly recommend pursuing the PhD.
For the nurses out here like us, like me, who aren't as familiar with what a day in the life of an academic professor in nursing might be or a research nurse might be, could you give us like a quick idea of what that might look like you yourself, a combined research academic nurse?
For me, and I'm only going to speak for me because this is, it does change every day. Like it really does. I have to be a very good steward of my own time. And if that means that for self-care activities that I actually block out on like 10 o'clock a.m. on Wednesdays that I need to do my own self-care and not schedule any meetings, then I do that. So I have to be a very good steward of time. I would say that, 25% of my time I do research that is involved in nursing workforce. About another 25% of my time, I work on another research grant that's specifically, looking at healthcare associated infections. Another 25% of my time is devoted to teaching, and that's 75. And then another 25% of the time to make the full 100 is service to the school or scholarship, or making sure that I'm writing my publications or, disseminating the work the research that I've done. So I wouldn't say there's a standard day, but I definitely tell nurses who are going to pursue a research career in an academic setting that it's imperative that when you look at your week ahead, that you slot out some time to just write and just process. So once you actually design your study and you conduct your study and you have all these wonderful results, it takes time to write that and to write that in a clear form. And if you don't block out time each week to writing, and I tell this to my doctoral students, that time will get filled up by other meetings, other personal things that, you also not want to sit down and write. Sitting down and writing is actually very hard. Sometimes it might take someone, or it might take me 10 to 15 minutes to get in the zone. And then once I'm in that zone of writing, the last thing I want is a phone call or Zoom, because I'm in that zone. So I always tell new doctoral students to really look at your calendar, a week. And if that time is like 12 at midnight from 12 to 1, and that's when you're the most functional to write, fine. If it's 6 o'clock in the morning, and it doesn't have to be these weird hours, but just looking at when you're the most productive to write is really important.
As a benefit, though, it does sound like you're saying there's quite a lot of flexibility in the schedule.
Yes. So that's also one thing for all those future nursing professors out there who is listening to this. One wonderful thing about the academic world is you have a little bit more flexibility than the 3 12-hour shifts that you pick up. Now, 3 12-hour shifts are in the hospital setting are fantastic because, nurses are notorious at blocking their time, working the 3 12-hour shifts, and then being off for like 5 days in a row and coming back. But there is a little bit more flexibility in the academic world, and you have a little bit more control over your schedule, but you have to be a good steward of that. And like I said, block out time for writing, block out time. I have courses and I have students that need to meet with me to get them to the next step in their academic career. So, and that's important. That's my responsibility to them. So it's just making sure that, you are organized with your time.
And in terms of being a good steward of your time for yourself, you're talking about self-care. How do you take care of yourself?
I run a lot. So I remember actually thinking at a certain milestone birthday that I was going to be writing a book on how to complete a PhD and run a marathon. So I never did that. For me, it is exactly what I said. Like for me, my outlet is running and exercise. And sometimes I have done this. No one knows my schedule per se. So if I just say I'm unavailable on my Outlook, from like 10 a.m. to 11 a.m. so I could take some self-care activities on Mondays and Wednesdays, it's just blocked. So those are some, I definitely say running for me is definitely a self-care outlet. I think another self-care outlet is, I try to surround myself with positive people, I have to say. And yes, I have a lot of friends at Rutgers. I have friends from my first staff nurse job that I spoke about. And, it's okay. We shouldn't feel guilty about, going out for a cup of coffee or taking some self-time to de-stress. Yeah, I think that's another like self-care. I will also, say that like other techniques that I have used that really kind of help is I do keep a journal, whatever people's feelings are about that. I've been doing that since I actually was a child. And I find that sometimes that's good because I could get the negative thoughts out of my head onto paper and no one ever reads them. And except myself, of course. And I have gone back to my, different decades of my life, looking at what I would write and be like, really, I was stressed out about that. But journaling is actually very, very helpful for me. So I think those are, taking time to like grab a cup of coffee with friends, family as such, running. Those are really my self-care activities. For those of you who are listening and considering a career in academia, just like when you were a new nurse and you had your first assignment, is really to be kind to yourself. There is a learning curve and it's okay. It's okay to ask questions. Just like as a new nurse, it's okay to ask questions. It's okay to ask questions in the academic world as well. Also being very clear, trying to know what, as much as you can before you accept that first faculty position, like what are the requirements to as a faculty member? What are the requirements to get promoted? What are the criteria that's set forth? Like trying to get as much knowledge that you can. And once you accept it, you were meant to be there. So just understand that try as hard as you can, because I have to do it too, to like put those negative thoughts about the imposter syndrome away. We are our own worst enemy when it comes to self-critique.
It's so fascinating because even as you say, it's so hard to put those imposter syndrome pieces away. Having looked at your CV and looked at your publications and looking at everything, it really affects everybody. There's all points of the career. There's the opportunity to be like, wow, do I really know what I'm doing right at this second? But not a single person looking at you would ever question that. So it really is like you're saying, if somebody hired you, if somebody saw potential in you, if somebody's asking you to consider a leadership position, go for it. That's what it sounds like the answer is.
Right.
Thank you so much, Pam, for joining us on the Nursing Insights podcast. It was such a pleasure hearing from you and learning about all that you've been doing. And thank you so much for contributing to the research that powers our profession, that gives us the ability to give the best care possible. So we look forward to hopefully having another conversation with you. And thank you for listening in, everybody. Take care. We'll see you next time on the Nursing Insights podcast.
This podcast is brought to you by the New Jersey Collaborating Center for Nursing and the Rutgers School of Communication and Information.